This is Charles, who came into my office and really came into my office. And a lot of you know me. I do a lot of bleaching in my office. I have bleached over 2,000 patients, and I'm very proud of that. It is my passion other than orthodontics. They go hand in hand, though. You think about whitening a patient, they go into orthodontics or vice versa. They are the number one and number two choice of any type of dentistry out there, and I do believe they go together. Charles came in on a whitening special. We were running a special. We run a lot of specials, and he was coming in, and he really wanted to see if he was a good candidate. And one of the things that you look at Charles's face is that he's not a candidate. And that was the hardest thing to break to patients, is that they're not candidates. But there's always a solution, and there's always a way that we can really have these conversations. But the reason why I have Charles in the presentation is because you have to ask yourself, when you see patients like Charles and you see all these restorations, okay, it's like, why does he have all of these? Did he have an accident? Did he fall? Did he, again, get hit in the mouth? Or is this the subject of occlusal disease? When you look at gold crowns, PFMs, crowns that have metal versus porcelain, mixed dentition there, right? Large amalgams the size of a boulder, and what I want you to look at, and I know you have, is crowns that have, wear through the porcelain, okay? And those are the things that you have to ask yourself when you see patients like Charles, which we see every day. How did it get there? Did he just say, hey, I want a crown on this tooth? Or did he just say, hey, I want to have a crown on my front tooth? Or, I want to have a half of a crown that's porcelain and the other half is metal? Why do you think that was prescribed? Probably because the biting surface was not very good, and they didn't want him to, they wanted the aesthetics / strength. But let's get down to the nitty gritty here and look at, what do you think happened? These are patients that are in our chair every single day. He's not a candidate for bleaching. And honestly, we never start a patient when we see things like this. The first thing that we have to do is figure out how this happened. And most importantly, if we just start prepping those teeth and putting him in new restorations, he might look good, but they're not going to last. Ask me how I know. It doesn't last. They'll look pretty. They'll love them, but they're not going to have them very long. And so these are the things that you have to recognize and know, because these are patients, again, in your chair. How about this patient? One of my favorite patients, Steve. And I remember when Steve came in, it was almost like we spent so much time together. We are best buds. To this day, we are very, very good friends. And when you become friends with people, you can pretty much tell them the truth, right? And what I found is that, I don't know, maybe it's because I'm getting older, but the more honest, the brutally honest that I am with patients, do you know the more dentistry that they do? They trust me. They know that I'm not there to sell them, and that I care, because I can tell you that I've been in dentistry for a very, very long time, and I don't have any reason to not tell them exactly what I see and why, because I have the experience. But if you know, and you haven't been in dentistry for 30 years, but you know what you're looking at, and you know how these things happened, you will have the confidence too. And I think that's why a lot of team members say, well, Shannon, I can't say what you say, and I don't know what you know. Well, yeah, you do, because let me tell you, after this course today, you're going to be asking yourself a lot of questions. And a lot of those questions are going to be answered in some of the things that you never really thought about, or maybe nobody ever taught you, because you're only as good as the person that trained you. And I was blessed to have amazing trainers, amazing dentists who taught me the things that I know. And what I know now when I look at Steve is, I told him, I said, Steve, what'd they do? Just go any, mini, mighty, mo, let's crown every other tooth? What was the reason that they put a crown on a central, a crown on a canine, and a crown, let me tell you, look closely. Look closely. Okay? When you think about the things that you see and why things happen, what is it that you see in Steve's maxillary arch? Do you see two centrals? Do you see two laterals? Do you see two canines? This is where we're messing with what we were born with. Because what has happened is, if he was missing a lateral, they moved the canine to the lateral position. Guess what happens when you don't keep teeth where they were or where they should be? We see significant breakdown in other teeth. Now, if they're not born with one, and we think about choices now we have so many choices. And I can tell you just a few weeks ago that there was a patient that came into my office wanting to do Invisalign, and he was 14. He's missing laterals. And his mother asked, could we move the canines into the lateral position and then just buzz them off? And I will say that I looked at her and I said, my doctor didn't even have to even come in the room to tell her this. I said, listen, you are setting him up for failure. And first of all, let's talk about the world today and putting those canines in the lateral position. You are going to have him look like Count Dracula. And then he's going to be subject to bullying, being made fun of, being self-conscious. And he's a good-looking kid, and I would not do it. The other thing is, let's be real when it comes to function and moving teeth in the position where they should not be. We have canines for a reason. And I can tell you that if that's the dentistry that you want, we're not the practice for you, because we're here to save teeth, and he is so young. And I have 6 kids. I would never, ever do that. Never. Because that's a decision if he wanted to do, he would have to make. But there are so many other alternatives and so many things that we can do now that we didn't have before. And I begged her, I said, please don't do that. Whether you stay with us or you go somewhere else, it's not a good decision. And I really have to look at your son here, And so those are things that you really and truly have to hone in and hit home. So this happened to Steve, and that's what I want you to really be looking at. What am I seeing? Why did this happen? Why does Steve have crowns on his front teeth? And no one says, I want to crown every other tooth. So, it could be that maybe, and again, I'm not here to make fun of other practices or other dentists, but I always ask myself, did they have enough occlusal foundation and understanding? And when teeth are not in the proper position, these are things that we're going to see. These are patients that are in our chair every day. My team will say, Shannon, I can't say these things to patients, and I don't know what I should be saying. And I will ask them, well, do you know what you're looking at? And we have to quiz each other. We have to really pay attention, because sometimes, one thing looks like one, and then it's not, it looks like something else, or this might be, attrition and it's not, could be all different types of things that are going on. But once you know it and you know what to look for, and doctors confirming it, and really talking with your doctor to say, listen, I really want to learn this, and I want to make sure I'm correct on the things that I'm seeing. Again, we're not diagnosing. We are team members working together for the better good of patients. So you're not just an assistant sitting there suctioning. I am someone that's gathering information and looking at the patient when I'm taking photos, or talking to the patient when I see things and bringing things up. That's what our job is, not to just sit there, not say anything, and pass instruments. Okay, so that's my soapbox. I'm gonna get off of it, and let's talk about that. Until we know what it is we're looking at, we can't really have those conversations. And if you don't know, you should not be having those conversations, because you could mislead the patient. What I want you to understand is 75% of the US population, you're in Canada, but let's still give you the percentages, have malocclusion. That really makes you no difference. So we really have to look at understand, what is it and what's happening. Everything starts with where the teeth are positioned first. We really have to understand that, we are building an overall oral health appointment. We're not the same anymore as we used to be. We're giving advice on nutrition. We are healthcare workers now. It is a mind and body all connected to this oral cavity. And it is not separated. The head's not separated from the rest of the body. It is connected directly and indirectly. When we put food in our mouth, what is the closest? We think about the brain being there, right? We are putting things into our body, and a lot of times we're the reason why things are deteriorating, and it's self-inflicted. But I also believe that the education is not there, and we're not really giving that education and having those conversations because we're worried that we're going to sound like we're selling them. And I will tell you that everything you do is how you say it. And if you look them in the eyes, what we're going to talk about, and have those conversations, patients will know that you're not, and you're sincere. There's so many things that happen when we're not really understanding, about the heart disease and, what happens with periodontal disease causing, preterm low weight babies, stroke, diabetes, thinking about the age of diabetes now, and looking in here into the US. I think you guys are a little bit more conscious or health conscious in Canada, but oh my God, we'll sit and eat, fried pork chops. I'm from the South because that's what we do. Everything's fried pickles, fried tomatoes, fried this, fried that. We're not really looking at what are we doing to our bodies, macaroni and cheese and putting butter on everything. I love me some butter, and so these are the things now that I'm more aware of than ever, and respiratory disease. We have to really explain these things to our patients, but most importantly, asking them about their habits and, not just assuming that they know these things and what is a contributing underlying factor. We do know that when we look at anterior crowding of 3 millimeters or more, it's going to serve as a host factor for bacteria. I'm not going to give you a whole bunch of words that you may not even understand because there could be some new assistants in this audience or watching this webinar. I want you to really think, and I'm going to break it down in elementary terms. And it is not rocket science. When the teeth are crowded, you cannot keep them clean. And I'm going to tell you, for a lot of you that are listening to this, you can probably put your tongue on your front lower teeth right now, your lower mandibular arch, and feel the crowding. And you cannot tell me that it is very easy for you to keep those areas clean. And that's something that, again, when you're looking at, I train my team to take their eyes and always go straight to the lower interiors first, because this is where we really start by looking at malocclusion, looking at rotation, looking at crowding, and then we work our way back. And so, again, you got to train your eyes, especially for new team members, or if you're training new team, that this is where we have to look. The other thing is understanding, having an understanding of what's important to the patient. There are some patients that want to know every little detail. And there are some patients that say, just do it and don't tell me anything because I don't want to know. Just go on and do it. The other thing is some patients don't really and not there for the aesthetic component of dentistry. If we say, how do you feel about your teeth? Do you wish they were lighter? No. Are you happy with the way they look? Yep. Then they do not have a value in those things. So now I can continue to talk about aesthetics and it is never going to register. So we have to kind of figure out, if someone's working out and they're very health conscious and they're, organic, eating organic foods and really, really into their health. Those are the patients that are probably going to understand more about malocclusion and why that is important. And, so I think this is where we're going to have to spend a little time listening, not talking, listening to try to figure out what those values are. And then at the end, we always want to help the patient make good choices. At the end of the day, it is always their choice to say yes or no. And they have all the right because, again, it is their choice. It's their body and it's their decision. We're just there to tell them, the options, but most importantly, what happens if they do nothing? And that's what I want you to really be thinking about. There was a study done at Spirit. I love this study. And if you want it, I will make sure you get it. And it was called the cracked tooth study. They sent it out to 200 patients within their practices. And one of the things that they found, which really hit home for me, because I'm building a school of education for assistants. It's called the Academy of Chairside Assisting. And because I was so tired of the education that was out there was nothing in the US for assistants. Now, let's be honest, in Canada, you guys are different. You guys are CE junkies. In the US, I can tell you they don't even care if they go take a course, which is really sad to me. And so, learning and really knowing now how humans learn, whether we're tactile learners, which most of us are in dentistry, we're audio learners, we're visual learners. Those are the things that I had to learn more about and have an understanding. So when I saw this and saw the study, it really hit home. And after all of this study of these, or really asking this questionnaire of 200, they showed them a video. They did treatment planning on a tooth that was broken, and they shared with them by holding a mirror and telling them, the possibilities. Then the other alternative was for them to show them a video on a cracked tooth, and how it got there, what happened, and then what are the consequences if they don't treat it. What was really amazing is here is where they, I said 200, it's 400, 400 people over the age of 40. over the age of 40, and they had to make at least $50,000 a year. And they also had to go to the dentist at least once a year. But what they found was that 35% of those patients didn't move forward with treatment because they only were handed a mirror and they were just talked to. 24, though, did say that money was not the reason that they didn't move forward. 24%. That's a high percentage. 35% didn't move forward with treatment, but 24 said that it wasn't about money. So why did they not move forward with treatment? So after we showed them the video, only 16% would wait and fix it. They would not do, 16% would not do anything right now, right? Only 16% would wait to fix it. 84, this is what I want you to look at. 84% of the patients felt that wait and see was a bad choice. 84. Now go back, 24% didn't list it as, money. Money was the reason, right? But when you think about why somebody didn't move forward with treatment, what do you think the number one reason why was? They didn't even understand why they needed it. They had no clue. They were just told they needed it, but they didn't understand. So when you show them a video, again, depending on the type of person that they are, sometimes we can tell them, sometimes we can show them a model. Maybe they want to see it, but the other thing is it hasn't registered. So I really like to go 3 routes, and that's what you're going to hear from me today is 3 ways, because sometimes we don't know the type of patient we have in the chair. We don't know the type of learner that they are, but what we need to make sure of is that we've got all our bases covered. That's what I want you to think about. 86% said repairing a cracked tooth is really, something that when we think about prevents more work, but when we show them videos, 91% would move forward with treatment after seeing the video. Why was that? Because they understood. 78 reported that they would like their dentist to show more videos. People are visual. They want to see it. Whether it's video, it's simulation, they want to see it. We automatically assume that they don't want to know and they don't want to see things and we're not going to bother them with what we're doing. But unfortunately, what we know from previous research is only 8, actually it was 6, I think the last time we looked at the study, 6 to 8% have ever seen videos as part of a presentation, videos in general. And that makes me sad because there's so many videos out there where you can show the patient, it registers, and this is where I think we just don't think about that. We just assume money was the issue and they couldn't afford it right now. They couldn't do it. It wasn't that, because they'll go down the street and buy a washing machine and dryer. They'll go buy a new iPhone. And, that's one of the things that I think we have to really talk to our team about, because they just assume that people won't do things. But do you know what an iPhone costs right now? How many of your patients have an iPhone? $1,200. We have to make, though, dentistry affordable, and we have to make sure that they understand. But again, visual, getting it. So let's talk about what I say. And this is something that I use as an assistant. And I can tell you that I took a lot of this really from a good friend of mine, really 2 friends, Tom Orant, who used to do a lot of pearls for your practice. I still refer to Tom, and I'll talk about him a lot through this course. And then my very, very good friend, Sherry Kay, who is a hygienist and did a lot of courses at Pankey. I adore her. We were partners, did a lot of training together, team training. She would train the hygienist and I would train the assistant, and I learned a lot from her. And so I really loved listening to her, and most importantly, marrying a lot of the similar conversation pieces. And so I want to give her credit for both of us developing this. And these are the things that we say to patients. And I'm going to give you this verbiage for you to really, listen to, but most importantly, take it and make it yours. So what I'll say to the patient is, even though we have masks, we now have, loupes, we've got a shield, we've got a bonnet on, right? We've got all of this gear. We automatically assume that we're scary to the patient. And most importantly, now we have to work harder than ever to talk about treatment. I will say that I think the most important thing is for them to understand that it is still you. For an existing patient, it's one of the things that is really important, is for them to understand that even though I have all of this on, it is still me and I still care about you. And that is something that you have to get across first. The other thing is the only thing that we have now are our visuals and our eyes. And this is hard for a lot of people who can't look someone in the eye because you're shy, or maybe you never were taught to do that, or maybe you have some self image issues. And sometimes it's hard for us to do that. And I was one of those people. But I had to tell myself that when I look someone in the eye, I become more sincere and more honest. And it will come natural for you, I promise. And I do this because even before COVID, because I wanted them to know that I was serious. And most importantly, I was ethical and that I cared. So I look them dead in the eye. If somebody's looking you in the eye, you know whether or not they're lying to you. You know whether or not they're just feeding you a line of bull, and I'm not. And that's what I want you to really think about, is having the conversations. How are they going to know that I'm serious and I'm not going to try to sell them on dentistry? Look them in the eye. Really mean it. And so this is what I say. Before I bring your chair back today, and they're sitting up, they're not in a compromised position. When we put people in compromised position, which means laying them back, they don't take us more serious. And I think sometimes they just blow us off. It's not serious, especially those that are not someone that wants to listen. I want them to sit up. So before I lay them back, I'm going to say, before I lay you back, please tell me what you know about your overall health. And this is a new patient. What do you know? What are some of the things that I'm going to see when I lay you back? You know why? Because they're talking to me. They're going to tell me what's happening in their mouth. What are some of the things that I'm going to see? Prepare me for some of the things that, I'm going to see before I lay you back. Why would you say that? But think about it. If I asked you that, what are you going to do? You're going to tell me what's going on, right? Because you're not dumb. You know what you're not doing or what you're doing. And that's when I want to hear it. The other thing is that, it is important for us to have that open dialogue, because the other thing is if it is an existing patient, I always say, hey, Jane, looking back on your chart this morning in the huddle and yesterday when I was going over all of my patient records, I noticed and wanted to look back on and reflect where you were the last time. The last time that you were here, I know that we had some significant bleeding, especially a lot of debris and buildup on those lower front teeth. And we talked a lot about that, and really giving you some significant, points, and most importantly, talking about how can we turn that into healthy gum tissue. And what I'm hoping today is that we're going to see a significant improvement. And so we'll be able to look back and compare where we were the last time and where we are today. So that's what I want you to think about. Prior to bringing them back though, I always say, I'd like to ask, the patient really, how do they want that information? How would they like for me to deliver it? Not everybody's going to do that. I also want to tell them that, that I am here to give them as much information about their mouth as they want me to give, because you don't want to just start spouting off all these things and it's not that type of learner or that type of patient. But at the end of the day, I also remind them that at the end of the day, it's okay to tell me, whether or not this is something that you want to do, or, always thinking about, the patient on the other end. And one of the things that I'm here today is I'm here for you. This is not my practice. I work here. And my role here is to be here for you. And so I want you to know that you can totally be open with me and tell me some of the things that you feel or the things that you really and truly are open to discussing, because we're a team here, right? And that's why I love my patients here. They stay here for a very long time, and that's what our reputation is. But most importantly, we care about you just like we care about our family. So again, that really helps to open up that dialogue. The other thing is I value relationship that is based really on the patient being in control. I want the patient to be in control. I also want to make sure that at all times that my role is being one that is their advocate. I'm there as their advocate, and I want to help them to achieve any goal that they want. But at the end of the day, it is their decision. But if we never tell them the possibilities, they'll never know. And you say, Shannon, wow, you're really harping on this. But I think that this is where we're so worried that they're going to say no, that we don't tell them the things that we see. And again, getting back to understanding the trust that they have. But this is where you want to sit them up first, have the conversations with them, and then laying them back. At the new patient appointment, I will say that I do things a little bit different than some of the fellow peers or fellow speakers out there. There are some speakers that really believe in shaming the patient is the way to get them to move forward with treatment. I would never do that. And if I was ever done that way, I would not come back. I never want a patient to feel guilty or feel like they are not doing their part. We're there to really help them overcome that. I always wanted the new patient appointment to really say that my hope would be that long-term goals were either established or that idea of goals were introduced, right? We really want them to understand. And part of that role, I think, as the assistant and most importantly, the hygienist, is to be attentive really to the patient goals. What are they? And most importantly, if they don't have them, we got to help them create it, right? It's never too late. It's never too late. I'm not there to shame them either. I don't like that. If the goals are not clear, and we feel like they feel like we're pushing them into treatment, or we move too quickly into treatment, that dentistry isn't valued. We cannot push a patient. I do not like that. If I go into a store and they're trying to, be right there on me and, jump on me as soon as I walk in, it is a turnoff. I will leave. And I mean that. I don't like that. And dentistry that we know is sold will oftentimes turn into no-show patients, okay, cancellations, or patients who don't commit to financial arrangements. Why? Because they're going to nitpick the things that you do, and they're also going to not see the value. And most importantly, they're going to feel that, they should have never done it. Right? So think about that. You don't want to push someone that's not in a financial situation either, because guess what? That becomes a financial burden, and they start to pick things that you did. And I know that firsthand. When you're doing any type of cosmetic aesthetic dentistry, you're going to see some of these people, right? So I want you to be aware of it. Dentistry that's planned together, really based upon values and really desires, will result in those patients who are really long-term patients. They show up for their appointments and they pay us, right? With gratitude. And I think that, we want to learn our best what's important. Again, helping them to understand and their decisions and understand choices. And while I love the idea of going through consequences, I love that, really. But I would tell you that I'm not going to shame patients. And most importantly, I want to give them options. And I would always include that awareness piece that really highlights what's healthy, right? Because I always start, with, let's talk about what's good, and then we're going to talk about what's bad, right? It's the same like with my kids. Well, let me tell you how good you did, and I'm so proud of you, but then let me tell you this. And it's kind of like an employer saying, well, you're doing so good at this and this and this, but, right? That's what we're going to kind of take that same mindset. And, it is imperative for the patient, again, to feel good about those possibilities rather than being shamed. You don't want to shame them. And first, I want us to really, pay attention to what's healthy. Let's talk about that. What's healthy? And then, what you like about your mouth, what you like about your teeth. And then we can explore, what you may want or what could be different. And remember that the purpose of us using, our health scan today, using our x-rays, using our photographs, these all are diagnostic tools that we're going to utilize to help the patient understand where they could go. And most importantly, what happens if they do nothing, and where they might want to go, simply, where you are today and where you're going. And that's one of the things in dentistry is we don't take enough of looking back, reflecting where they were. Let's look back. Let's look back. Let's look back.